Good morning, Okan. 8:34. Happy Tuesday to you. Mames, I don't think I yell too often. I try not to.
I think I yell at you more than you yell at me.
We try to keep a good culture here. We
Yeah,
try to have
we
fun.
do the best we can.
We try to keep spirits alive. You know, we aren't curing cancer here, although laughs can cure cancer, maybe they say at some point. We've got someone who knows what it's like to see many different workplaces. Dr. John Kello joins us this morning. How are you, sir?
I'm good. Thank you. Thank you for having me.
I'm happy to start with any of your titles because you are a scholarly gentleman, as I've learned thus far. But for those who maybe don't know of you or haven't met you before, how would you describe what you do in the work that you've done, let's say, for over the past few decades?
Let's just go back to scholarly gentleman. I think that's a mic drop moment.
Yes.
So thank you very much. I've enjoyed our time together today. I am a professor emeritus of industrial organizational psychology at Davidson College. I have a graduate faculty affiliate appointment in the organizational science doctoral program at UNC Charlotte. And I am the president of my own consulting firm, Johnny Kello and Associates. So I wear several hats, but they're all connected around building positive cultures, positive workplaces.
Is the psychology, remind me, is that the one where I lay on the couch, or is that the one where they check the wavelengths inside the brain?
We can do all of that. This is a full-service psychology program here.
All right, when you say industrial organizational psychology, you're analyzing what, the inner workings of how employers and employees interact with each other, or what's the basis of what you're actually doing on a day-to-day research?
In our field, industrial organizational psychology, we identify as scientist practitioners, by which we mean we contribute to the research, we keep in touch with others' research about how organizations can function effectively, and then that's the science side. On the practice side, we take that evidence-based knowledge and bring it into the workplace. So as a scientist, I contribute to the body of knowledge about how organizations can optimally function. And then as a practitioner, I take that information out to client organizations to help them build a sustainable, positive culture built around positive leadership, built around accountability, built around productivity, safety, stress management. So we aim to understand and then improve organizations.
So as an example, we have a suggestion box that you can remain anonymous at here. And one of those is about the temperature inside of the studio. Mm-hmm. Is that an example of something that you would analyze and research for a company to see, hey, does temperature inside the building contribute at all to the organization?
We would. And actually, those kinds of questions are some of the earliest questions that industrial psychologists began to ask and answer in the early 1900s. As the widespread availability of electricity developed, factories were able to run 24/7, and the questions were, well, what's the right light level? What's the right temperature? What's the right schedule of payment? What are the right break schedules? Should it be a 10-hour day, an 8-hour day? So early industrial psychologists were all about those kinds of issues.
High fluorescence at 64 degrees.
12-hour days, I think, is what we determined here. Yeah.
How did the journey start for you, though? I mean, my gosh, to have been doing this for 50 years, we'll say, right? And so what was the moment where you said, hey, I want to go down this path of psychology?
When I was in undergraduate school, my advisor was an industrial organizational psychologist, and I didn't know anything about the field. But I studied with him, and then he was working with a large government organization to promote safety in the military. And so he helped me get an internship, a co-op, with the United States Navy in my senior year of college. And I worked with researchers who were looking at naval aviation safety, and they were looking at the whole range of issues to promote safe operation of naval aircraft, including such things as cockpit design. So I began to get really interested in a branch of my field that's called ergonomics or human factors. Like, how much visual information can a pilot process before it's overload? How much auditory information can they process? How do we build a cockpit that human operators can make sense of and operate safely and efficiently? And so I was hooked from that time on. I was 19 to 20 years old, and I was contributing data, research-based data, to help the Navy design cockpits for jet fighter planes. Now, it doesn't get a lot cooler.
I was about to say, that sounds like the coolest job
cool.
ever. Yeah.
It was super cool.
So over the years then, are there any kind of moments that kind of pop up to you beyond that, right? That's the start, right? Okay, designing cockpits was how it all began. I mean, over the years, there has to have been some moments. Can you share with us any of the times where you say, well, I look back and this one was really cool, or this was really a breakthrough, or this one really was interesting? What kind of stands out to you?
My undergraduate advisor went to Virginia Tech. I went to Old Dominion University, but he took a position at Virginia Tech, and he introduced me to some of his junior colleagues who were working in industrial organizational psychology. They were working in community psychology. So sort of the early versions of strategies to help people with recycling programs and using their safety belts in their automobiles before there were mandatory state laws requiring that. So I got the opportunity to work with this research team based out of Virginia Tech. And we did research that really laid the foundation for the modern approach to occupational safety. And that is looking at organizations, the kinds of industries that are collectively called high reliability organizations, like operating airplanes, like surgery, like first responder groups, where you really can't afford error. Error has got to be minimized, eliminated to the extent possible. So we started to do projects with the nuclear industry for nuclear operations shortly after the 3 Mile Island nuclear event. Mm-hmm. And that led to some research, very similar work going on with the airlines. So I spent a year at the University of Texas at Austin working with a research group that had grant support from NASA, other branches of the federal government, FAA, and we started working on airline cockpit safety as well as safety in the nuclear industry, safety in healthcare, and identifying just some of the basic principles that allow operating teams to be on the same page, to be mindful, to be aware of the situation, to be communicating, to make sure that the information that they're sharing is understood and acted on. So we built what are called crew resource management, CRM training programs. The FAA was initially interested in making those available, gradually made them a requirement for the airlines. So I take some measure of pride in having helped to build those foundational safety programs for the airlines and other HRO, high reliability organizations.
In this day and age, it just seems to like mental health is such a conversation. Mm-hmm. Is that pour over into this world with you at all?
It's all connected. It's all connected for sure. So one of my areas of research, I mentioned HROs, including surgeons, but actually anyone involved in healthcare is participating in a high reliability organization where they have to do it right every time because the consequences of a mistake can be catastrophic. So I got involved in doing some research actually as part of a consulting project with a medical services company that does concierge medical practice design and implementation. And I got deeply into issues of stress and burnout among healthcare providers. And I started to work on a book with a colleague who's at a major medical school just as the pandemic kicked in, which spiked everyone's stress level and risk.
Great timing for that research.
Yeah, and burnout. Talk about burnout
out.
during that for the healthcare professionals too.
So yeah, if the common denominator, the lowest common denominator is building positive cultures that are productive and safe, focusing on a burnout to manage stress, to reduce error, focusing in on safe operation in aviation, focusing in on, even in conventional industrial settings. One of my mantras has been, if this approach to safety works in the nuclear industry and in first responder groups and in healthcare providers, why would you not want to incorporate those best practices into your daily operation? Yes, you may not be as much at risk for a catastrophic event, but people get hurt and worse on the job. So why don't we take those evidence-based principles that we know promote safe work, bring them into your fabrication and assembly operation, into your flour milling operation, into your food service operation.
What's been more fun for you, the teaching side and being able to educate, or the consultant side where you're doing it for the private companies?
It's really all connected. Because when I'm consulting, I'm teaching. Now, they're not my students; they're my clients, and I don't give them a grade, and I can't fail them, and I won't fail them. But it's all a process of taking the information, the knowledge that I have developed based on the research, and helping organizations understand how to use that information. So, as an example, one of my areas of research and practice is workplace meetings. And it turns out that meetings are a major predictor, the effectiveness of meetings, major predictor of individuals' level of engagement and satisfaction with their company, with their boss, with their job. So helping to take what we know about building effective meetings, the right cadence of meetings, having the right people there, having an outcome that we're aiming at, having an agenda circulated in advance, all of those strategies have been used to help organizations build a more positive culture, in this case, focusing in on making our regular meetings more effective, reducing just the misery that a lot of people experience with, okay, it's Monday morning, the boss calls the staff meeting, we sit around the table, we talk, but I don't really need to be there, and we don't really accomplish anything, but boy, we just had another weekly meeting. So helping organizations understand how to improve those aspects of their work, it's teaching, and it's very satisfying to me.
Wow, it's like you're sitting on our team's meeting.
I know. It's like we're here right now. I know.
Yeah, your boss brought me in actually to discuss those meetings. That he thinks they're great, by the way. Don't know what your problem is.
Dr. John Kello of Davidson College, also of Kello and Associates. He's an industrial organizational psychologist. Thank you so much, sir, for joining us this morning.
I enjoyed it very much. Thank you for having me.